After a long winter, spring is just around the corner and the kids very anxious to get outside and play. But did you know that each year over 5 million children are treated in the emergency room for playground-related injuries? In this morning's Your Health Matters segment, we are joined by Dr. Robert Keehn, pediatric orthopedist with OrthoMaryland. He has some tips for keeping your kids safe this year. Good morning.
Good morning.
Thanks for being here. And I think this is the time of year that it starts. We start venturing out. And what are some of the things that you see?
Well, it's true, and you know that our children are our most prized possessions, and we need to keep them healthy and we need to keep them safe. And with the good weather now, they're going to be out on the playgrounds, and we need to make sure that we prevent any injuries. So we as orthopedists, we see a lot of injuries that children have that adults also have, but children are not just small adults. They have their own separate injuries that they have. As you know, children are growing, and therefore they have what's called the growth plate. And when children fall off of a slide or a swing, they can fall on their outstretched hand and injure the growth plate. So we want to protect that, and we want to make that diagnosis.
And that can have long-term effects too.
That can. Most of the growth plate injuries are minor. We put them in a cast for several weeks and they get better, but we want to make sure that they don't have any long-term sequelae from those injuries.
I think the hardest thing for parents is you want your kids to go out and play. You want them to go down the slide and run around on the monkey bars. What can you do to protect them without limiting them from all the fun?
There's a very interesting injury that I see usually once a month. I just had a child with it last year on the slide. And what happens is that the parent puts the child on their lap, goes down the slide. As the parent, with their force, goes down the slide, the child's leg gets caught and sustains a fracture. So I've seen that too many times. You know, that gives a lot of guilt to mom or dad, thinking that they're injuring their child. It's not that serious. We put them in a cast for a few weeks and they sort of heal, but it's something that we can prevent. So I would tell
the kids.
I would tell everyone, let the child go on the slide themselves. Of course, supervise them. Don't put them on your lap.
That's good. And you've got something in your hand that I think all of us are familiar with, but sometimes we forget to put on.
Well, this is, I always describe this as if I wanted to go skydiving, I'd definitely wear a parachute. And I believe that there's about 80 million bike riders in the country today. And what's incredible is that 43% of bike riders don't use a helmet. So this is just mandatory. And we know that falls from bikes can cause severe brain injuries, which are preventable. And I think the helmet is the most important thing. So we want to get a good helmet that fits properly. It has a nice plastic shell with good foam inside. It should fit properly. It should sit snugly on your head, not tilt or move around, with a good chin strap. So I advise everyone riding a bike today to use a helmet. And the parents should use a helmet because we have to show that our kids will wear them also.
Dr. Keehn, thank you so much. Great information. I'm sure that'll help some people out there today.
My
Appreciate
pleasure.
it.
Thank you.
And remember, of course, at the Health Expo, you're going to learn all about this kind of stuff and so much more this Saturday at the Convention Center.